Hey, good afternoon. This is Dr. Darwin Hayes, drdarwinspeaks.com. drdarwinspeaks.com. Hey, we're here on a Tuesday. Just wanted to give you today's Tuesday tip. Hashtag today's Tuesday tip. Today's tip deals with one of 9 mistakes I often see a lot of new dentists make. And unfortunately, they're making them and don't even know that they're making them, not even really conscious of the fact that they're making these mistakes. And the first mistake that I want to go over today, there's 9 of them, but we'll just do one today as one of the tips. The first mistake is deciding not to do a residency program, whether it's an AEGD or if it's a GPR, which is a school-based general dentistry program, or if it's a hospital-based general dentistry program. And the first mistake is not doing one. You know, guys, this is probably it's the first one I'm going to talk about, but it's probably one of the most important ones. I think that allows you guys to really get jump-started in your careers right after dental school. You know, dental school has its limitations. Spend a lot of time, didactics in clinic, but actually not enough time in actually clinics to the point where, you know, a lot of you all graduating out of dental school just don't have a lot of experience, a lot of confidence and proficiency, especially in certain areas like root canals, extractions, dealing with kids, maybe even crown and bridge. All right, you'd be surprised as many residents that we get in our GPR program, how many of them have done more than 5 endos, root canal treatments from start to beginning. How many crowns, how many bridges they've done. And it just really depends on the residents. It just really depends on the school that the resident goes to. But there's so many different reasons why you should do a GPR. I actually talk about this, and I have another video that you guys should watch. Check out my my website at drdarwinspeaks.com, drdarwinspeaks.com, but also my YouTube page, Dr. Darwin Speaks. You can check there. And the title of the video is 9 Reasons Why a Dental Residency is Not Optional. The 9 reasons why a dental residency is not optional. All right? And one of the reasons it's not optional is because you guys don't know what you don't know until you get into a situation where you don't realize you don't know it, whether it's how to do a certain type of procedure, how to navigate around a curved canal, treatment planning, etc. All of which are great reasons why you guys should do a residency. One of the most prolific things that we see with a lot of our residents after spending 12 months with us is the fact that they have a much higher level of confidence in their treatment planning ability, and they're being able to treat patients from start to finish, doing comprehensive care. They increase their speed, which goes along with their confidence. They get a chance to be exposed to different types of treatment planning methods with different providers, also networking with other residents that have graduated from schools all around the country, especially here in our residency program. We've got people from Puerto Rico, California, Canada. We got some international students. We have some students from NYU, University of Florida, University of Texas, Connecticut, Arizona. The list just goes on and on and on and on. So those are some of the reasons why you should not make the mistake and not do a residency. You guys gotta do it. It's also going to help you later on as you graduate from the residency program. There are a lot of associate positions where they want somebody who's got some additional experience, especially in root canals. I know as a private practitioner, where we were looking at associates to come in, one of the first questions that I was asked, and one of the questions that I would ask associates or potential associates was, are you comfortable doing molar root canals and how long does it take? So if you haven't had any rotary experience, or you've taken 3 or 4 hours to do 1 or 2 steps in a molar root canal, you need to do a residency so that you can get that additional experience and a little bit more proficiency, and increase your time and your confidence and your comfort level. All right. Another thing that is important so that you don't make that mistake and not doing a residency is the fact that you'll get some paid time off. Paid time off to do continuing education. All right. In addition to the lectures that you'll get, usually you'll get up to about 150 to 200 hours of CE or lectures, which is very, very key. It's a continuation of the things that you've learned in dental school, but now you're being able to use it more of like an evidence-based type of practice, and the things that you'll be able to use and continue to use throughout your career. Another reason is that you'll be able to get a stipend or get a salary. Most programs you can get paid anywhere from $30,000 to up to or past $60,000 a year, which is not bad for being able to train, get CE, and then you get paid to do that. So this is going to be basically the first and last time that you're going to be able to actually get paid to learn. So don't make this mistake, guys. Do a residency. Start applying now. For those of you that are graduating, get ready to graduate in the next year. You're third-year dental students going into your 4th year. And even if you're a rising third-year dental student, start looking at programs. Start visiting some of the programs. Start looking at areas where you want to live. And we'll talk a little bit more. But first of all, do not make the first mistake. Do not decide not to do a residency. You guys got to do it. Hope that helps. Stay tuned for more videos and more of these tips. We'll have another tip next time. All right. But again, today on Tip Tuesday, mistake number 1 that you do not want to make as a new dentist is not do a residency. You want to make sure you don't make the mistake. Make sure you do a residency, whether it's an AEGD or a GPR program. All right. Hey guys, hope that helps. Take care. See you next time.